Let's talk about how to respond when somebody is choking. There are two types of obstructed airways, partial and full. A partial obstruction is when the airway is only partially blocked. Some air is still able to move through the airway and the person's still able to cough. Their breathing is audible and their skin might be flushed. If a person has a partially obstructed airway, all we want to do is encourage them to cough and stand by in case it gets worse.
Just keep coughing. Just keep coughing.
Don't give them food or drink. Don't perform back blows and abdominal thrusts. Just encourage them to cough and monitor the situation. Ideally, forceful coughing is all it takes to dislodge the object. If a person becomes too weak to cough, their condition will rapidly deteriorate into complete choking. Call 911 immediately if you haven't already, and prepare to treat a full obstruction. A complete or full obstruction is when the airway is completely blocked. Air is no longer able to move through the airway and coughing is impossible. Now the person might be clutching their throat. They can't speak or cough and their lips might be gray or bluish. They might also try to leave the room. Before you start treating them, introduce yourself and ask if they're choking. It's important to act quickly.
Are you okay? Are you choking? Do you need help? I need some help over here.
Start with 5 back blows. Move beside the person, reach your arm across their chest to their opposite shoulder to support them. Have them lean forward, and with the heel of your hand, give 5 hard back blows between their shoulder blades. If their airway isn't clearing, give 5 abdominal thrusts. Landmark by placing your hands at the top of their hips, and then move your hands around to just above their belly button. Make a fist and place the thumb side against the person's abdomen. Place your other hand over your first for extra force and thrust inwards and upwards. If they're still choking, continue with another cycle of back blows and abdominal thrusts until the object comes out or the person becomes unresponsive and you need to start CPR. Always seek medical attention after treating complete choking. An object lodged in the airway can cause damage, and so can the abdominal thrusts and chest compressions. If a person experiences partial choking, they should seek medical attention if they have any kind of respiratory distress after the incident. If there's no sign of injury in the first few hours after the incident, they're likely fine.